Imagine stepping into a sterile operating room, a place where miracles are supposed to happen. Hospitals promise safety, precision, and healing. But what if lurking behind the mask of modern medicine there exists a darker story, one where tiny lapses in judgment snowball into horror? In this video, we unravel a series of real cases where routine surgeries turned fatal. You'll hear about doctors who left instruments inside patients and experts who removed the wrong organ. Emmeline Nguyen elective surgery that turned into a nightmare, Colorado, 2019. When 18-year-old Emmeline Nguyen walked into a Greenwood Village plastic surgery clinic on August 1, 2019, she expected a confidence boost from breast augmentation surgery. According to court testimony reports, Nguyen went into cardiac arrest shortly after anesthesia administration. Clinic staff began CPR, but the doctor in charge, plastic surgeon Dr. Jeffrey Kim, refused repeated requests by nurses to call 911. For 5 hours, while Nguyen's heart and brain starved of oxygen, Kim insisted he could handle it in-house. She had sustained irreversible brain damage, leaving her in a vegetative state. 14 months later, she died. The horrifying part is not just the cardiac arrest, complications can happen, but the breathtaking arrogance of the surgeon. Had he picked up the phone at the first sign of trouble, Emmeline might have survived. Instead, the doctors attempted to protect their reputation, terrified that an ambulance outside their clinic would send the wrong message. Prosecutors charged Kim with attempted manslaughter. A jury agreed, and he faces prison time. This case exposes how the ego can override basic common sense. In the United States, there are protocols. When a patient's heart stops, you call 911. Watching Emmeline languish while a doctor plays hero is exactly the kind of mistake you can joke about in hindsight, but one family's tragedy makes the humor sting. Nguyen's story also reveals systemic issues. Many outpatient cosmetic centers operate with minimal oversight compared to hospitals. Staff may not be trained to challenge a surgeon's decisions. And because the procedures are cash pay, some doctors cut corners to maximize profit. Dr. Christopher Duntsch, Dr. Death and His Trail of Carnage, Texas, 2012. Christopher Duntsch was a charismatic neurosurgeon practicing at Baylor Plano and later at Dallas Medical Center. Between 2011 and 2012, he maimed dozens of patients and killed at least 2. He operated while being high, ignored anatomy, and seemed to treat surgeries like experimental play. The Texas Observer reported that hospital administrators were so tolerant of his behavior that he had to kill someone before they suspended him. During his first surgery after a month-long suspension, Duntsch nicked the vertebral artery of Kelly Martin, a 55-year-old elementary school teacher. She bled to death in the intensive care unit. Astonishingly, the hospital quietly let Duntsch resign rather than reporting him to regulators. Weeks later, now practicing at a different hospital, he operated on Flola Brown, a 64-year-old woman undergoing routine cervical spine surgery. Duntsch again cut into a major artery, causing catastrophic bleeding. Brown suffered a stroke and died. Another patient, left quadriplegic, recalled the assisting surgeon physically grabbing Duntsch's instruments to stop him. Nurses whispered that he was drunk or high during cases. Lawsuits revealed he had a history of substance abuse and had skipped multiple drug tests. Yet hospitals kept credentialing him because he generated revenue. This is not just a story about one bad apple, it's about an entire system that prioritized profits over patients. In 2017, Duntsch became the first surgeon ever convicted of aggravated assault for actions in the operating room. He received a life sentence. The case inspired podcasts and a television drama aptly titled Dr. Death. Picture a surgeon at the head of a table, scalpel poised, insisting he's the reincarnation of God's gift to neurosurgery while nurses watch in horror. William Bryan's The Wrong Organ, Alabama, 2024. Sometimes an operating room error is so egregious it borders on slapstick, except that someone dies. William Bryan, a 70-year-old Navy veteran from Alabama, traveled to Florida's Ascension Sacred Heart Emerald Coast Hospital in August 2024 for what he believed would be the removal of his spleen. Instead, surgeon Dr. Thomas Shaknovsky removed his liver. According to The Guardian, during the laparoscopic splenectomy, the doctor transected the liver's major blood vessels, causing immediate and catastrophic blood loss. Worse, he labeled the removed organ as a spleen and only realized his mistake after Bryan died. As the family's lawyer noted, typical anatomy places the liver on the right and the spleen on the left. The surgeon apparently missed this day in medical school. Bryan's case would be hilarious if it weren't tragic. Picture a surgeon pulling out an organ the size of a football and exclaiming, "Wow, what a massive spleen," while a nurse whispers, wrong side." The Guardian reports that Shaknovsky had previously been involved in another wrong site surgery. Bryan bled out on the table, leaving behind a widow after 33 years of marriage. The family is pursuing legal action and demanding criminal charges. This story underscores the importance of surgical timeouts, anatomical confirmation, and perhaps reading a basic anatomy textbook. Eric Gilbert, an unrecognized arrest, Oregon, 2018. Routine procedures are supposed to be uneventful. Eric Gilbert, a 43-year-old man from Portland with obesity and sleep apnea, underwent a colonoscopy in October 2018. These risk factors made airway management critical. During the procedure, his oxygen saturation plummeted and he went into respiratory arrest. Instead of immediately stopping the scope and securing his airway, the gastroenterologist continued, and the anesthesia team misinterpreted his apnea as sedation. For 22 minutes after he stopped breathing, CPR was not performed. By the time a code blue was initiated, Gilbert was in full cardiac arrest. He was resuscitated but declared brain dead shortly thereafter. The ensuing malpractice trial centered on whether staff should have recognized the respiratory arrest sooner. Witnesses testified that vital sign alarms were ignored and the team focused on finishing the scope. A jury awarded Gilbert's family $50 million. In anesthesia, a sudden drop in oxygen isn't because the monitor's broken, it's because the patient isn't breathing. It's like an auto mechanic working on your brakes while the engine explodes. The human error is clear. The team either didn't recognize or didn't believe the data in front of them. This case underscores the importance of monitoring at outpatient centers. Many colonoscopies are performed outside hospitals by sedation teams who might not be anesthesiologists. Recognizing high-risk patients and having a plan for airway emergencies is essential. Gilbert's death also illustrates how long delays in starting CPR lead to irreversible brain damage. In a cardiac arrest, every minute without chest compressions decreases survival by 10%. 22 minutes is an eternity. Bart Reiter Music Bingo in the Operating Room, Colorado, 2023. If you think you've heard it all, wait for Bart Reiter's cataract surgery. In February 2023, the 56-year-old went for a routine lens replacement at a clinic in Lone Tree, Colorado. During the operation, surgeon Dr. C. Stark Johnson and anesthesiologist Dr. Michael Urban allegedly played a smartphone game called Music Bingo. Instead of focusing on the patient's vital signs, they were busy guessing song titles. Within minutes, Reiter went into cardiac arrest. Nurses later testified that the monitors alarmed repeatedly while the doctors kept playing. By the time anyone noticed, it was too late. Reiter died of cardiac arrest. A lawsuit claimed that had the doctors been watching the monitors, they would have seen his oxygen drop and heart rhythm change. The case settled for an undisclosed sum. The operating room is not the place to play mobile games. You are not supposed to live tweet your surgery. Following Reiter's death, the clinic implemented strict no-phone policies in the OR and required additional training on situational awareness.